So my name is Cliff Willmeng. I'm a registered nurse, about 13 years experience, mainly ER, some ICU, even some primary care stuff like that, but primarily ER. My family just came back to Minneapolis, came back to the Midwest about a year and a half ago. And, we knew that Minnesota Nurses Association was here in the Twin Cities. It's a very, it's a large, again, 22,000 member union, entirely made up of RNs. It's active in Minnesota primarily, but also just has organized as well in North Dakota and some in Iowa. So it's a very powerful union. I got a job at United Hospital emergency room in October of 2019. My intention at that point was to, be a good nurse and to maybe be a steward with the union and file grievances and help organize my coworkers like any other steward would do. Obviously with everybody else, I did not plan for COVID-19 to take place. And, so I was a very new member in not only the union, but the hospital when that pandemic hit us. We were wearing the N95s for 5 days. It's strange how kind of struggles break out, but, a position that a lot of us there in the ER took was that, we were afraid to bring this virus home on our scrubs. We didn't want to get our families sick. I know I was, by March of 2020, I was having to text message my brother and say, if me and, Mary are hospitalized, you have to drive up here and take care of our kids. You have to get our kids because we have nobody up here to take care of them. We're new to Minnesota. So, to me, it was a moment, it's a life and death moment. We had to start taking matters into our own hands to protect ourselves in that environment. For myself, it also took the form, and many others, of us putting on hospital scrubs that were widely available in the hospital at that time. And, our intention was to put those on and be able to leave them at work where they could be commercially laundered so we didn't have to take a bundle of infected fabric back into our house. And so, we started being written up for disciplinary reading for reasons, being out of dress code. Can you imagine fixating on dress code in the middle of a 100-year pandemic? Well, that's the hill that the struggle broke out on. And, we were getting satisfaction in multiple different areas. For myself and lots of nurses, we, went to the media, we filed OSHA complaints, we obviously filed grievances. We were trying to organize on the job as union members. And I was certainly identified as a leader by management, written up consecutively for uniform code violation, and eventually fired for that. And that was on May 8th of 2020. This was not, and still isn't, a fight over a 25-cent raise or, an extra 5 minutes on your break. When we're fighting and putting, advocating for ourselves and, our patients, there's nothing that is more dear to a nurse than, obviously our own lives, the lives of our coworkers, and the lives of our patients. There's probably no three things that are more critical and more valued with any frontline healthcare worker. So when we're talking about safety and we're worried about spreading what we now know to be a lethal virus, we're going to fight like our lives depend on it. When we're trying to carve out some safety for ourselves and, to really assert ourselves as decision makers in healthcare, the people that should be making the decisions, there's only a certain amount of decision making that can go around. So the more power frontline workers take, that has to come from power from somebody else. And usually that power is appropriated by the executive administrative class, and, that do not see patients, that are collecting handsome paychecks every week, and that are unessential. They're unessential workers. We don't need them in the hospital for it to function. And the hospitals are run on a model that is common everywhere. Everybody knows it. It's called the lean model. And what that means is that you take your equipment and your staff, and you bring the equipment down to the bare minimum, and you bring your staff to the bare minimum. So you redline both of those to generate the most amount of money for your corporation. And they knew that they were supposed to stock PPE. All the studies were coming out from OSHA, the Department of Defense, epidemiologists were writing book after book about this. They predicted this pandemic almost to the letter. And yet, in March of 2020, we found ourselves begging for N95 masks, trying to go to Menards and Home Depot to find these things because the CEOs made the decision not to have this stuff on hand. That was a decision. That was not an accident. They were not blindsided by this. This is a corporate model. So, yeah, I mean, to me, the worse the crisis has become, the more obvious it is to me that these folks have lost all authority to make decisions on healthcare. I mean, they obviously cannot be trusted with a healthcare system. They're in it for reasons that are not fundamental to patient care and to workplace safety and to public health. They're there to make a check and make a career out of it. And, that's, from the beginning, our demands were that we be included in decision making. And that, again, is the most contentious thing, a frontline worker could actually suggest, because it puts you at the center of control. And these institutions really need to be run by the healthcare workers in collaboration with the public we serve. How do you get elected in a union that you've only been a member for a year? And certainly as somebody that has felt the heavy hand of the hospital administrators firsthand, to me, I think that it's not just a hope that we start to have a new labor movement, that we start to redefine and pioneer what that means in the 21st century. It's a requirement.
Speaking a little more about these two kind of dimensions of our struggle that are often divorced, but really can't be or shouldn't be. You're talking about a new labor movement as well as the struggle against racism and oppression. And I kind of want to hear about what that looked like, both, in terms of perhaps limitations that you saw on the part of labor in getting in the fight in solidarity in the uprising against police in Minneapolis. I'm just curious because I did hear about some really interesting kind of worker-led initiatives, like on the part of the Minneapolis transit workers. So yeah, and also from the Minneapolis nurses, I wasn't able to see or hear what was going on in your sector. But yeah, what was the response from your perspective?
Well, those events were just amazing. I mean, they were amazing. So I was a lot of the healthcare workers got to be front and center in those events. I mean, we were running medical support because, a lot of those protests, the police were extremely violent and heavy-handed, and it was difficult for first responders to get to the crowd. So there was, ad hoc committees that were put together to start deploying healthcare workers around the protests. Yes, the bus drivers refused to transport police during that time, and the topic of racism, hit into the labor movement with a lot of force. And from our perspective, and I could say from my own, it put the union in a very awkward position because, as most unions in the United States are almost just proxies for the Democratic Party here. And so this is an election year, and Minneapolis has been controlled by the Democrats for 70 some years. They are the ones that hire and fire the police. They are the ones that have maintained a system of gross economic disparity, certainly hitting the communities of color the hardest, but also even working class whites as well. And, so how do you create a campaign against racism when its systemic aspects are being maintained by the political class that you seek alliances from?
Mm-hmm.
So it's a contradiction. And it, it becomes very glaring when you start to, the rubber starts to hit the road. What is the essence of any union? It is mutual solidarity and aid. So that was a big part of, our campaign running for board, to address that kind of racism. But like, holy cow, like, what do you do with it? What do you do with the police? I mean, a lot of those police are drawn from working class communities. A lot of nurses, as you know, are married to police officers. They're police officer, the police have their own union. It's independent here, but it's, within the confines of the AFL-CIO nationally. So, we're really having to reinvent a lot of this stuff and reinvent, what a class conscious anti-racism looks like. In 2020 for frontline workers during the course of a pandemic. I'll tell you my perspective of it as one nurse here in Minnesota. And, we've got nurses that voted for Trump. Minnesota almost went for Trump. And to me, that kind of white supremacy that he embodies and exudes, which I think is acted upon by the Democratic Party just as much. They just don't promote it as such so directly. But, look at what has happened with white working class people over the last 3 decades. And, obviously the communities of color have been hit by, things like corporate globalization and outsourcing and the destruction of communities far longer and far more intensely. But you've had in Chicago, for example, where I'm from, we lost like 80,000 steelworker jobs. This was during the course of Bill Clinton's presidency. It was during the course of NAFTA and the World Trade Organization. Biden campaigned. He campaigned on a slogan that nothing would fundamentally change. He didn't spring this on us after the election. That's literally what he was telling people. And so I think that has driven a profound despair and terror and demoralization into the white working class that has been exploited by, I think, fascist elements. And, they're being successful in doing it. And, it's easier sometimes to get those white workers to blame immigrants and people that don't look like them for their problems instead of the actual source. And, 70 million people voting for Trump had to land like a ton of bricks on everyone. And, to me, you can't fight that type of reactionary, deep-seated racism and proto-fascism with a milquetoast neoliberalism. You just can't do it. What I think is more effective is really fighting on class lines. And unfortunately, because the unions have been funneling their membership into the Democratic Party and have been losing over and over and over again, our working conditions, our membership rates, our pay, our everything. That class consciousness has been somewhat destroyed. Not completely, but it's certainly been weakened. And, if you want an example, like one of the things that I ran for board on was the concept of political independence, which is that, working class people are not represented by these two political parties. They're not represented by, multimillionaires. They're not represented by Wall Street. And they're really not represented by, Joe Biden. And they're not represented by Trump. And, the unions would have the power today. If we can pour $300 million into a Democratic presidential campaign every 4 years, we could start our own political organization that would look like us, that would be run by us, that would be, be able to tackle things like racism and poverty in a substantial way, public education, access to healthcare, the environment. These are things that neither one of these political parties have any answers for. And I believe it would start to foster an independent sense of self for working class folks that could cut through that kind of racist crap that is really leading a charge right now. So, if we're going to put a metric to it, I took a a motion for political independence into our House of Delegates meeting here at MNA. I mean, where, again, I've only been a member for a year. And for a moment, I thought it was going to pass. And, you know, it basically said that MNA would divorce itself from the Republicans and Democrats. It would not provide them labor, and it would not provide them money. And that we would be able to fund our own candidates and start to explore some alternatives to those two parties. And it got 27% of the vote. Now, that's the first time around with a brand new concept being advanced by a member of 1 year standing. Mm-hmm. So to me, there has to be some mood there. I think that workers want an alternative, but if that alternative is either not built or if it is repressed, you get shit like Donald Trump and Joe Biden. And so, you know, I mean, to me, I think that kind of, you know, and as white workers, we have to stand up. I mean, we have to stand up and demonstrate solidarity. It's not enough to promote it, you know, as an abstraction. And we have to envision something new, because the community here in Minneapolis made it quite clear that the party's over for this stuff. And what does that mean? I mean, how do you do that? How do you get community control of the police? I mean, it starts to pull at the entire fabric of U.S. capitalism. So, like, these are big questions, and you know, our task here is to pioneer the answers. That's what we got to do. So we have to show defense of the people that are standing up, and we have to stand alongside of those folks. So, you know, I think that we have a strong case for arbitration. I don't know. You know, this comes to a neutral arbitrator. Who actually is spoken about well, who's respected within the labor legal community here. So one of two things could happen with the arbitration. I could win that arbitration, and I could lose the arbitration too. If I lose the arbitration, I have not been able to find work since being fired in Minneapolis. I've applied at least to 20 different union hospitals around here, and I can't even get an interview. So, you know, you can speculate all you want how that works. I've never had a trouble getting a job as a nurse. But if I lose the arbitration, I lose my MNA membership. And if I lose my MNA membership, I can't get on the board. So, you know, this is high stakes stuff. You know, if I win my arbitration, then I remain a member. I get put into the board of MNA on January 1st, 2021, where we can, you know, start to have discussions on how that transformation to a fighting rank and file union will look. And then I return to United Hospital in the ER. And yeah, if I said that there was not trepidation on my part, I'd be completely lying. I would be very nervous about walking back into that ER. I would be afraid that I'd have a target on my back the whole time. You know, I would be the living embodiment of a defeat of one of the largest healthcare organizations in the Midwest. So that's not a comfortable position for me. But to me, I made up my mind, you know, that, you know, we might win or we might lose. And there's going to be some casualties along the way. But if we show hospital executives what we're afraid of, that's precisely what they're going to threaten us with. And so I'm not bending. I'm not going to take a knee. I'm not going to cop out. I'm not going to lay my head low when it comes to my coworkers and myself and my family and the patients that we take care of. So yeah, I'll go back into that ER, and I'll be the kick-ass ER nurse that I know I am, and, you know, get right back to work, fighting for our patients and coworkers. I mean, that's what a steward's supposed to do. How can you support? You can get onto our website. It's frontlinersunited.net and just click Bring Back Cliff. And there's a list of things you can do there, which, you know, range from certainly circulating our petition to Allina to reinstate me in my job at United Hospital. You can donate to our little fundraising campaign for legal and for defense. Certainly feel free to post up onto Allina's social media about this. And, you know, Penny Wheeler's got a Twitter account, and all the information is there on the website. And then if you want to, you know, get a little sign that says "Bring Back Cliff" or hashtag "Bring Back Cliff," as you did from there in Argentina, and we'll circulate that and promote it. And so, I mean, you know, really from my family, it's incredibly moralizing. It helps my kids. It helps my wife. I sleep a little better at night. Not great, but better. And yeah, I mean, we want to design this to make a mark and to really, you know, show that you can't just dump on union activists and expect to walk away scot-free.